ओसीडी को फर्दर डिस्कस करने के लिए आज हमने जिस शख्सियत को दावत दी है अपने प्रोग्राम में, वो पिछले 10 साल से एनएचएस में एज अ चार्टर्ड क्लिनिकल साइकोलॉजिस्ट अपनी खिदमत अंजाम दे रहे हैं। इसके अलावा ये यूनिवर्सिटी ऑफ सरे में साइकोलॉजी डिपार्टमेंट में टीचिंग भी करते हैं। आज हम खुशामदीद कहेंगे डॉक्टर सरफराज जिराज को। वेलकम टू द शो डॉक्टर सरफराज। Can you hear me?
Yeah, I can hear you fine. Thank you. Assalamu alaikum, everyone.
Alaikum salam. Thank you for coming on the show today.
My pleasure to be here.
So, Dr. Sarfraz, you have worked in this field for a very long time, mashallah, and I'm sure you have come across a lot of clients who experience obsessive and compulsive thoughts and behaviors. Would you be, please, enlighten us, tell us about what anxiety disorder can lead to?
Yeah, absolutely. So I guess सबसे पहले, like, if we identify what is OCD, you started with your introduction telling us a little bit about those khiyalat, those wahm, those waswasa, and that is really the foundation that people can experience these intrusive thoughts that most of us would not pay any attention to. मगर कुछ लोग like pay attention to those thoughts in a particular way that becomes very distressing for them. So let me give you an example. Just yesterday, I went to I went out for a drive, and I came back, parked up my car, and then I just had this thought. Okay, did I lock the door? Did I close the windows? And then it's a thought I often have, and then I carried on. I went home. That's got on with the rest of my day. With someone who has OCD, that thought becomes much more serious. They can't rest until they've taken every action possible to minimize that risk. They feel that anxiety, that concern that something bad is going to happen. Now, this is just one example, but basically this thought, this type of thought that any one of us can have, this involuntary thought, most of us can deal with it in one way. Unfortunately, for some of us, especially when it becomes more distressing, when we give it a different type of weight, a different type of meaning, then that can lead to OCD. So it starts off with these thoughts, and there's many different types, which I'll maybe give some examples of as we go on. The other part of it, as you said, कि जब वो हमारे like behavior के ऊपर कुछ असर होता है, when it starts affecting us in what we do, not only what we do, but also what we don't do. Imagine if you're spending, like 6 hours a day just checking things, or just washing things, or just thinking about things, then of course there's so many other things that you can't do. And unfortunately, this is one of the big negative impacts of OCD.
You were going through the second peak of this pandemic, and most people with mental health issues, they're already struggling. And people who experience a lot of anxiety under normal circumstances, this advice that has been given that you should wash your hands frequently for 20 seconds. Now, someone who's experiencing OCD already, how is this going to impact them?
Definitely, for some of them, it can make it so much worse. And in my experience, I've had some people who already had some contamination-related OCD, and it hasn't really affected them because for them, the nature of their contamination and the nature of their fears was quite separate. But I have to say, for the majority of people that I've seen, that this has now made them more confused. On the one hand, they were washing their hands all the time, keeping away from touching anything, and they were told, no, mat karo, that's OCD. And now the government and all the guidelines are telling us you should do that. So it can make it more confusing for them. However, there are certain limits that we can use to help us differentiate what is a good, sensible, safe practice and what is going beyond the limit.
Lots of people, especially in our Muslim community, instead of acknowledging that there is a mental health problem, they are either in denial or they would blame some other things. when it comes to getting intrusive thoughts in your head, for example, you gave an example of constantly washing hands or checking whether the door is locked. Lots of people experience this on a daily basis, but they don't realize that this is affecting them and their daily functioning is being affected and they should seek professional help. Could you help us understand what the symptoms are?
Absolutely. You raise a really good point. We can't really be denying something or seeking support if we don't recognize it in the first place. Now, often some of the main signs for us to look out for within ourselves, and sometimes if it's not happening to us, but it's happening to someone we love, someone we have close contact with, the first thing is usually is how they're feeling. That they're usually feeling much more anxious, and what's going on inside someone else's head we can't see, but what we can see
Mm.
is their behavior. So I'll give you some of the classic behaviors that don't necessarily guarantee this person has OCD, but give us
Yeah.
some indication. And even with OCD, I think it's worth mentioning that this isn't something that you either have or you don't have. Many of us
Mm.
have kind of some level of OCD. Yeah,
Yeah.
it's just when it gets to a level that's beyond a limit, when it's really affecting us psychologically, emotionally, in our ability to function, that's when we need to look out for it. So some of the telltale signs is, first of all, just this anxiety, this constant sense that, kuch bura hone wala hai. This is
Yeah.
something just isn't right. And that bejeni then leads to a number of behaviors. So for example,
Mm.
one of the most common one is checking. So someone
Yeah.
who, for example, might check the door or the window, yeah, say lock hua hai ya nahi? They'll go again and again and again. To some extent, that some people will even take a picture or a video of themselves. कि ये ठीक बंद हुआ है, it's properly closed. I've
Mm.
heard it click. I've watched the video. I've recorded it. Then later on, if I have any doubt, then I'll watch it. But unfortunately, even that action, as I'll go on to say, doesn't give them enough tasalli. Yeah. So
Right.
checking is a big one. Some of the other ones will be washing. Now, washing is a good thing, especially in our faith. Tahara is really highly
Yes.
valued behavior. But even within that, there's a limit. Okay, like how long are you washing for? Kitni der tak, like
Mm.
until you get what level of satisfaction? And this line can become really blurred in someone with OCD. Some other examples are reassurance seeking, that someone suffering with this, because they're not confident about it, they have no conviction in themselves, they'll constantly be asking people, like, have I done this okay? Is this okay? Or maybe they'll be
Yes.
checking, maybe they'll be on the internet,
Mm.
maybe they'll just be looking and monitoring these things to an excessive degree where actually it's getting in the way of other things that they have to do, other things that they want to
Yeah.
do with their lives. So there is some of these examples of checking, reassurance, avoidance is another big one. So, for
Okay.
example, someone may go to a restaurant with you, but you'll see that actually they don't want to touch anything. They may
Mm.
need to use the restroom, but they'll just hold it. You'll see them struggling, but नहीं मुझे वहाँ नहीं जाना. Yeah,
Yeah.
that fear, there's that leads to that avoidance. And I guess one of the other ones, which is much more unique to many individuals and really depends on the type of OCD, is the sort of rituals. Um, so a common one is for someone to just count in their head to a certain number, or maybe just to kind of tap on something a certain number of times. Or, interestingly, it may be I have to do this dua, or I have to say this particular ayah or a particular word a number of times to make
Mm-hmm.
sure something bad doesn't happen. And again, this is where that line between what we have in our faith, what we value, is it's good to take Allah's name. It's good to invoke the Ahlul Bayt and duas, but also there's a limit within that.
Yeah.
And it's when people exceed that limit, then these are some of the signs and symptoms for us to watch out for.
So if we talk about the Muslim community specifically, what about religious rituals that become excessive or intrusive thoughts that are blasphemous or, you know? religious, and
Yeah.
that destroys someone's life rather than having a positive impact.
Absolutely, absolutely. So there's a subtype of OCD known as scrupulosity, and really this has two main possible features. One is that the thoughts that come into your mind may be very blasphemous. Yeah. So I was working with someone, for example, who kept getting these thoughts,
Mhm.
negative thoughts about swearing
Right.
Rasulullah sallallahu alaihi wasallam, or thoughts about defiling the
Mm.
Holy Quran. So
Yeah.
this person was getting these thoughts, and naturally these thoughts would be very distressing. I can't imagine anyone would be happy with these thoughts, at least from
Right.
a Muslim perspective. So this is the first thing, that the person is getting the thoughts. The second thing, though, is that the person may not be getting these type of thoughts. Whatever their intrusive thoughts is causing them some distress, but then their response is to engage in some type of ritual, some
Right.
kind of excess. And I've seen many people for whom, for example, wudu, that they will
Yeah.
be performing wudu, hundreds of times a day. Now, I don't know about
Sorry,
you,
Dr.
but if
Sarfraz,
I'm, yeah,
we have a caller online. We'll just take the call.
sure.
Assalamu alaikum.
वालेकुम अस्सलाम मैं नुमान बात कर रहा हूँ बेडफोर्ड से
जी
तो
Numan,
बहुत
welcome to
अच्छा
the show.
प्रोग्राम जा रहा है
जी.
और बहुत ही अच्छा टॉपिक आप लोग डिस्कस कर रहे हैं इसी तरह का एक मैं मिला जुला सवाल पूछना चाहता हूँ कि हमारे एक फ्रेंड हैं वो अक्सर कोई चीज डिसाइड करते हैं तो एक दिन बाद या उसी दिन जो है वो क्या करते हैं उनका वो अपना फैसला चेंज कर लेते हैं फिर थोड़ी देर बाद सोचते हैं फिर वो कर लेते हैं तो क्या हम कह सकते हैं कि उनको भी यही बीमारी लाक है या बस ये और चीज है और जैसे आपने वो बताया कि वो दौड़ और हाथ धोने वाला ही इस तरह की अलामत होती है तो क्या इस तरह का भी हो सकता है कि कोई आदमी अपना फैसला करे फिर बदले फिर करे फिर बदले तो ये भी कोई इसी तरह का डिसऑर्डर है इस पर जरा रोशनी डालिए प्लीज थैंक यू
ठीक है, थैंक यू. हम पूछते हैं डॉक्टर सरफराज. जी.
जी, ज़रूर शायद ये हो सकता है जब तक कोई पूरा डिटेल में असेसमेंट ना कर सकते तो वो डायग्नोसिस करना का कोई फायदा नहीं होता है मगर हम जनरल पॉइंट में थोड़ा एक्सप्लोर कर सकते हैं कि एनी प्रॉब्लम जो होती है if it's affecting that ability to function, to look after themselves, to go to work, to have a good relationship, then this is giving us some clue that this is maybe some kind of disorder, that this person needs some help. And you touched on this important point about shock. Now, I
जी.
wanted to share this example, if I may. There's a game show. Many of you may have seen this game show, Who Wants to Be a Millionaire? Have you
जी.
seen it?
Yeah,
Right?
definitely, yeah.
So, in the Indian version, I think they used to have Amitabh Bachchan. They had Chris Tarrant here on the UK version. So he's the games master. तो वो सवाल पूछता है और फिर वो contestant जो है वो जवाब देता है. Normally उसके पास 4 ऑप्शन होते हैं और मिसाल के तौर पर वो जो contestant है उसको सवाल का जवाब पता है. तो he says to the host, he says, the answer is B. तो वो host क्या करता है? उसका जवाब क्या होता है? Usually the host will say, are you sure? तो वो क्या करता है, वो एक शक का सीड आपके जहन में प्लांट कर देता है. तो फिर आपका नेक्स्ट जवाब क्या होता है? Yeah, I think I'm sure. So you start off being sure, फिर now this seed of doubt has been planted, you say, I think I'm sure. फिर दोबारा वो host क्या कहता है? Are you sure you're sure? फिर आपका जवाब वो शक वो बढ़ता जाता है. And you're saying, I think I'm sure. So then the host says, so, there's a lot of money at stake here. Maybe you should phone a friend. Maybe you should ask the audience. So in this process, rather than being confident in myself, my confidence becomes eroded and I start
सही
relying on other people. Yeah. तो जितना मैं अपने आप को सवाल पूछता रहूंगा, जितना ज्यादा मैं चेक करता रहूंगा, इसका नॉर्मल असर क्या होना चाहिए कि मुझे यकीन आना चाहिए. मगर इस तरह OCD में मेरा शक बढ़ता जाता है. मेरा अपना जो कन्विक्शन जो होता है वो ज्यादा कमजोर बनता जाता है. तो इसमें हम क्या ले सकते हैं कि अपने आप को आप जरूर सवाल पूछो, मगर उसकी भी लिमिट होनी चाहिए. जितना
right
ज्यादा आप सवाल पूछोगे अपने आप को OCD में, और या तो ये गेम शो में जितना ज्यादा दूसरे लोग आपको सवाल पूछते रहेंगे, इतना ज्यादा आपका शक बढ़ता जाता होगा. And this is one of the main basis of OCD. Okay, there needs to be some limit, and in the treatment really of OCD, this is what we do in therapy. Okay, we put that person in the position where they have shock, and then we support them to not use all this reassurance seeking, use all these rituals to help them prove to themselves कि जो मैंने सोचा था कि ये बुरा होने वाला है, ये हकीकत में बुरा नहीं हुआ. And we try to help build their own yaqeen in their own interpretation. कि बस ये बस like was just a thought. It really doesn't have a strong meaning. I hope that helps
yeah
to partly
yeah
answer that question.
that was a good example. Thank you for sharing that. I was just wondering, there are lots of people, at least I've come across, and they say कि नमाज के दौरान उनको बार-बार वहम और शक होता है कि हमने या तो वुज़ू सही नहीं किया या हमने कोई चीज़ मिस आउट कर दी है. It's not the second rakat, it's actually the third one. तो उनको ये
Yeah,
थॉट्स बार-बार आते हैं और शक और वहम की वजह से they are unable to focus on their prayer.
brilliant example. मैं हमारे यहाँ like पास में मदरसा है
So
local,
sorry, we've got
तो
another caller.
उसमें भी
We've got another caller.
yeah, go ahead.
Assalamu alaikum. Hello. Ji.
Possible to ask a question, please?
Yes, please. Of course, please do.
Okay. What it is, I would like to ask a question about my mother. She's got a very severe form of OCD in the sense that she washes her hands, she takes a shower, and it goes on for hours.
Okay.
And anything that she touches is with a tissue. She won't touch anything, even wearing the shoes or the taps or the door handles, everywhere it is. And she's not willing to take any help, and it is impacting the relationship so bad that she doesn't even like us to come into her rooms or her grandkids to come into her room. And when we try to convince her to seek some help, she becomes very agitated and very angry, and she just blocks us off and starts fighting with us. And she's quite old, 78, 79, and I know she's putting immense stress on her body when she stands for hours washing herself. She uses more than a bar of the soap a day. It's quite severe, but she's not willing to take any help. What can we do?
Right. Okay, we'll find out from Dr. Sarfraz. Thank you for calling.
Yeah,
Thank you.
thank you for raising that point, and sorry, just coming back in again. So sorry, I'm really sorry to hear about the situation, and it's very, very tough situation. And unfortunately, there's no easy answer to this. The general principle, as we started our discussion with, is you can't do anything until you recognize it's a problem. And for some people, until they can recognize that it's a problem, they're not going to seek help. And we this isn't just restricted to OCD. This is any situation in life. जब तक मैं खुद नहीं पहचान सकता कि ये शायद इसमें कोई प्रॉब्लम है, तब तक मैं उसके बारे में कुछ करने वाला नहीं हूँ. I'm not going to take a medicine for something that I don't feel that I'm sick. So this insight is a really difficult thing. The only tip I would offer in relation to this is that, when the person isn't feeling so distressed, then we just try and have a discussion with them about what they think are the impact of what's going on? You know, do they feel that what they're doing is having an impact on their relationship? Now, if they don't, it really makes us in a very stuck position. But sometimes, you know, हमारी आदत क्या होती है, especially हमारे फैमिलियों में, कि आप गलत कर रहे हो, ये बुरी चीज है, and the person, you know, they feel attacked, so they push back against us, and that stops them recognizing कि ये जो मैं कर रहा हूँ, इसमें शायद कुछ problem है. Yeah. So the first step is just to try and support them, give them the safe enough space to say, actually, what I'm doing is having this negative impact, and then just gently using that as an opportunity to say, well, is there something you would like to do? Maybe some expert that you could speak to that might help you with this, and not telling them that they have to change everything. That might be an outcome that comes that they decide to do, but you know, ultimately, you know, you can take a horse to water, but you can't force it to drink.
Of course. Before the call came, you were talking about people who get thoughts about wudu, that it's not done properly, or the number of rak'ah while praying.
Yeah, no, absolutely. I mean, I think that, so I was just saying how I was actually teaching this lesson in the madrasa about namaz ihtiyat, doing your sajda shav, which are actually tools in our religion, in our deen, which make it so comprehensive. You know, it's something that gives me so much more yaqeen in our faith, that, you know, Allah subhanahu wa ta'ala, he is our creator. He knows us. He knows that we are vulnerable sometimes to these doubts and shak. And he's given in our salah, he's given us conditions for when, if you have this certain level of doubt, what you should do. And by and large, I think that the principle is that we give ourselves the benefit of the doubt. You know, it comes back to this question about doubt. Now, it's when people pursue that doubt, when they ask themselves too many questions, that then they become bejan. They lose that confidence and they lose the ability to carry on. So, for example, you know, did I do my wudu? Did I wash my hand once or twice? Now, if it's a passing doubt, then actually I give myself the benefit of the doubt and I move on. The challenge becomes if I ask at every single stage too much, and I get caught up in the literality of doing everything in an exact, precise way, that then I lose the spirit that actually this is about cleansing myself physically and spiritually as a preparation for the next step. But it's when that same process of doubt kicks in, and it's not just the doubt, because we can all be subject to doubt, and you know, which you said, but it's how does that affect our behavior? Now, have I gone back to do my wudu again, and then had the doubt, and again, and there's 2, 3, 4, 5. You know, many of us, maybe we'll do wudu, maybe we'll have some doubt, we'll do it again. Very few of us will then have to do it a third time. But if you notice yourself, तीसरी दफा, चौथी दफा, पांचवी दफा, now you're thinking, okay, मेरे वुजू में कुछ problem है या फिर मेरे शक में कुछ problem है.
Same. And we have another caller. Assalamu alaikum. Wa alaikum assalam. Thank you for calling.
जो इस्लामी तालीमों में मिलती है ना, उसको फॉलो कम करते हैं हम. जब हमारी बॉडी कमजोर हो जाती है, अचीवमेंट जल्दी हम लेना चाहते हैं, हमारी अपनी ग्रीडीनेस है कि हम जो भी चाहें जल्दी जल्दी उसे खींचे कि हमें मिल जाए. जब नहीं मिलती तो दिमाग में बुरी बुरी चीजें और सोचते हैं. फिर ये जो माइंड सेट आता है ना इंसान को, वो कहता है कि जो भी चीज मैं जल्दी जल्दी अचीव करूं, जब नहीं मिलती तो ख्यालात आती हैं. अगर अकीदा पुख्ता है, वुजू कर लिया तो हो गया. आपकी नीयत है, नीयत किसी चीज की भी कर लिया और उसे अपने आप को शक में न डाले, वो अल्लाह पे छोड़ दे. तो अल्लाह कहता है कि जो भी तुम काम करते हो कल मेरी रजा के लिए, अपने अच्छे भलाई के लिए, तो वो मेरे पे छोड़ो. वो मैं कबूल करूंगा ना करूंगा ये इंसानों को इससे दूर है. अभी कुछ ऐसे पे चले जाते हैं मेंटली, वो अपने आप को डिले करते हैं अचीवमेंट लेने के लिए. जब सब्र भी नहीं करते हैं कि अल्लाह से मांगते हैं यहाँ अपने जहन को रखते हैं कि हमें मिल जाए ये चीज, और वो लेट तो मिलती है, अल्लाह
जी
ताला कहता है सब्र करो, सब्र इसलिए
जी
कहता है कि सब्र करो, मैं तेरी तुझे दूंगा इसी दुनिया में जो तेरे लिए लिखा है।
जी
हम जो
बहुत
मांगते हैं वो जो लिखा है हमारी किस्मत उससे ज्यादा,
जी
ये
बहुत
हमें
बहुत शुक्रिया
आज
आपकी कॉल
समझनी
का।
चाहिए।
आपके कॉल का बहुत बहुत शुक्रिया। आप कोई सवाल करना चाहेंगे हमारे गेस्ट से?
सवाल तो नहीं है वो भाई, बहुत अच्छा
जी
प्रोग्राम बता रहे हैं दुनिया को, मगर थोड़ा सा मैं
बहुत
बताना
बहुत
ये है कि
शुक्रिया।
सब्र का पैमाना ना हम छोड़े हाथ से, सब्र करना सीखे और शक को दूर कर दे। जब आपकी नीयत होगी सब लोग आप पाक हो गए।
बेशक
अगर वो नीयत अपने आप में शक कर रहा है तो फिर तो इसका कोई सोल्यूशन है ही नहीं है,
जी
मिलेगा नहीं। यही है हमारे व्यूअर के लिए, जिन्हें ये शक है वो शक निकाल दे, आपकी नीयत हो गई है वो आप पाक साफ हो गए, आपको
ठीक है,
दूसरा
बहुत बहुत
गुरु
शुक्रिया।
करने की जरूरत नहीं।
जी बहुत बहुत शुक्रिया आपके कमेंट और फीडबैक का, बहुत बहुत शुक्रिया। खुदा। Yes, Dr. Sarfraz, you were telling our viewers about intrusive thoughts regarding prayers and wuzu and ablution. I think we are experiencing some technical difficulties. Maybe we should take a short break and then join back, inshallah. Stay tuned. आ गई मैं खुशामदीद। हम बात कर रहे थे जुनून और यास की बीमारी की, यानी कि ऑब्सेसिव कंपल्सिव डिसऑर्डर, जिसमें वहम, शक, शुबहात और फिर वो कंपल्सिव बिहेवियर जो आपकी जिंदगी को मुतासिर करते हैं। ब्रेक पे जाने से पहले हमने बात की थी उन ख्यालात की, उन वसवसों, उन वहम की जो हमें इबादत में खलल पैदा करते हैं, यानी कि वजू का बार बार करना, हाथ का बार बार धोना, लेकिन इस शक में मुब्तला रहना कि हमारा वजू सही नहीं हुआ या हमारी नमाज सही नहीं हुई. Gee, Dr. Sarfraz, you were giving explanation about these kind of intrusive thoughts that people get.
Yeah, so just to get all of us experience these intrusive thoughts at some stage or another. The difference is mainly our response and how much trust we put in those thoughts. And we started our whole conversation today by saying that every one of us has some thoughts. Waritha, I'm wondering, could you maybe give us an example of thought that just came into your mind that actually you didn't like?
For example, is my internet connection working? Is my phone line working? Shall I go and check?
Yeah.
Although I've made all the checks, but still in my mind, I'm constantly getting this. What if it breaks up?
All of the time, these kind of random thoughts. And, imagine life where we have some random thoughts. No one would ever do anything new. Yeah. So we rely on having some random thoughts, some intrusive thoughts that are not intentional. And this, probably the most important point to understand, is that the thoughts that come into our mind, these are not intentional. So when I'm, praying my namaz, that if I had a doubt about whether I'd done something right or wrong, it's not like I meant to have this thought. The doubt was coming. Yeah? And generally, we give ourselves the benefit of the doubt. And our faith gives us the tools of reciting namaz ihtiyat, of doing a sajda shab for cases where doubt has affected us. So it gives us a resolution. The problem lies, and particularly with OCD, is when we go beyond those, when we don't allow those tools that we have to give us a solution, when we don't give ourselves the benefit of the doubt, or that we use the wrong method to get us out of the doubt. Now, just to give you one example, imagine you are in the ground and someone gives you a spade. Well, that's the only thing you can see. So, you need to get out of this hole. You want to try and solve the problem. But instead of propping the spade up against the wall of the hole and using it as a platform to help you climb out of the hole, you use the spade to dig a deeper hole. So your attempt to fix the problem actually makes the problem worse. And this is exactly the kind of thing, the problem that we see in OCD. And it's for us as community members, as people who love our family members who may be suffering with this, them compassion. That we understand they're not doing it on purpose. They are trying their best to solve the problem. It's just that they're not using the tools in the best way, or maybe they're not using the appropriate tools.
So can I ask you, what are the leading factors for obsessive compulsive behavior and thoughts?
Yeah. So again, really good question that helps us first of all to make sure we don't demonize anyone for having OCD. It's not like they have some kind of weakness or there's something inherently wrong with them, because to some extent, any one of us, if we're put in the right circumstances or maybe the wrong circumstances, can develop a vulnerability to this. So from a CBT, it's a type of therapy. From that perspective, some of the theories suggest that people who have an excessive sense of responsibility. So I'll give you one example that you notice there's a higher number of people who develop OCD after giving birth.
Oh,
Now, why?
interesting.
उसमें क्या है? But if you think about it, गौर से अब देखने जाओ तो वो जो माँ जो बाप होता है, now they have extra responsibility for this child. So
Right.
that sense of responsibility is now reacted to in a way that may, not always, but may lead to OCD. So in terms of these causal factors, some of us who grow up with that heightened sense of responsibility may be more vulnerable. So there's some data that shows if you're the oldest sibling, that you may be more vulnerable to OCD because, many of us who are the oldest sibling know that we might have more of a responsibility for our younger siblings, for example. It doesn't happen in every case, but it does happen in other cases. दूसरा जो है, some of the other vulnerability factors include early beliefs about the lack of security. So, say for example, you grew up in a family situation in an environment where everything felt quite dangerous. Maybe your halat, maybe the situation of your parents meant that they couldn't offer you that consistent security. Maybe because you had to move all the time or whatever it is. None of these are absolute predictors. I'm just saying these are vulnerability factors. Yeah. And any one of these by themselves is not enough. It's a combination of those vulnerability factors, maybe some biological factors, and our halat, our current life events and circumstances. All of them accumulate. And where everyone's familiar with this idea is that it was the straw that broke the camel's back. So many of us actually carry a lot of this straw around with us. But some of us, we just loaded with that extra bit of straw, and then that then results in the development of OCD.
Do children also get OCD, or is it just prevalent in adults?
No, there are some cases of OCD in children, but it's noted much less frequently than in adults. And I guess I can mainly speak from an adult perspective because that's my area of expertise.
So what kind of treatment interventions you offer to people who are suffering from OCD?
Well, it mainly depends on the severity of the presentation. So some people might have a slightly milder form of OCD where it's having some impact on their life, but not so much. And others may have a more severe presentation. I think one of the callers, talked about how their parent was really struggling and it was really entrenched, and they will need a change. Now, just before I talk about those, I did want to take the opportunity to mention what is prevalent in Muslim communities. Yes. So where people may not understand that actually there may be some medical help for this, they may pursue a religious answer first. And in some cases, it may work for them. But I think what we really have to be careful of is that the people we seek help from really understand what this problem is, so that they don't, it doesn't make us as people seeking help vulnerable to getting some dodgy treatment. And I've heard a number of my patients who've said, yeah, I was just, I paid a lot of money and I got this taweez and it hasn't made any difference. It's just made me poorer. Now, I do want to emphasize that actually there are many people who offer something useful. I just really want to highlight the point that there are some dodgy people. Look out for them. Yeah. Get a reference first before you seek help. From a medical perspective or a sort of a professional psychological perspective, when things are more severe, we may use medication, antidepressant medication, as well as talk therapy. And among the talking therapies, CBT or cognitive behavior therapy has been shown that it can be very effective. And for a number of people, they may feel that after a course of therapy, when they put it into practice, actually it can relieve the vast majority of the symptoms.
So alongside therapy in cases that are quite severe, do they also need medications alongside cognitive behavior therapy?
Yeah. So we would say that therapy can be helpful for mild cases and more severe cases. Some of the severe cases may benefit from a combination of medication and the talking therapy. And if it's helpful, I can give you a brief overview of what someone might expect in therapy.
Mm-hmm. Please.
Yeah. So first of all, you would have an assessment. At that point, your psychologist or the clinician would ask you about how the problem is impacting on your life. That everything would be that you discuss is kept confidential between you, the clinician, and your GP. And then you do some analysis of the triggers. What kind of situations make you more vulnerable to having these kind of obsessive thoughts, and then to help you understand what is the hakikat, what is the nature of these obsessive thoughts. Um, Once we've done that, we look at the relationship between how those obsessive thoughts, if we believe in them. So, for example, if I think, oh, you know what, I think, what if someone is driving too fast and they have this accident? Now,
Yeah.
whether it's happened or not, if I believe that it's happened, if I've got yakin in
Mm.
that, then actually I'm going to run out of my house and go and check. Yeah.
Yeah.
So is that now behavior? Is that justified? So what we would try and do in therapy is try and explore where is the evidence for what we're trying to do, or what we're trying to stop, and gradually give us some exposure to those things that we might fear, so that we can get some real life evidence, some real life yaqeen that, I don't have to keep washing in order to be clean. I don't have to keep doing this checking in order to be safe. And it
Right.
helps me align myself with my goals, and what's happening with the people around me.
There is a common misconception, in fact, misconceptions and myths around OCD in our community. And one of them is that people don't understand that there is a chemical imbalance in the brain or how the brain works, but they tend to blame the individual. They're quite judgmental, and they'll say the iman or the faith is weak. This is why the person is behaving in this way, and that वहम का कोई इलाज नहीं है. These are some of the misconceptions. What would you like to say about that, please?
Yeah, well, I mean, I think that the point you made about being judgmental is a very true one. That if we really follow the learning from the Ahlul Bayt, the first thing we should be thinking about is compassion. When we say Bismillah ar-Rahman ar-Rahim, we're talking about the compassion of our Lord. If that is so important, then where is that in our lives, and where is that in our judgmentalism of people who are suffering? Um, so, I mean, I think that's the first point. Second point is, "Vaham ka koi ilaj nahi hai." Well, I think if the person is interested and committed to trying to challenge that, and if they're supported with the right kind of help, then, I mean, for the last 10 years, I've seen exactly that. कि वहम का इलाज है, बिल्कुल. So definitely, if someone is willing to be supported, and if they're getting the right help, we can definitely make a difference. And like I said, you don't choose your life experiences. When you was a child, the environment you grew up in, the challenges your parents face, you didn't make a choice about that. And if that influences the problems that I might experience later on in life, or the halat that I have, those bits of straw on the camel's back, that isn't my choice. If it was my choice, then blame me. But you'll find that most people with OCD, it isn't their choice how it developed. And then, once they're in this problem, they're trying their best. Nobody with OCD wants OCD. They want to get rid of it. They try their best. Sometimes their strategies don't help them. And that's where
And
some professional support.
it's genetic as well. So if the parents or the grandparents had it, there is a chance that the next generation will have it too.
Yeah, so I'm glad you raised that, and you made a point about this chemical imbalance, and I think before we make any really strong conclusions on that, there's still not enough research to conclude that which one came first. Um,
Okay.
what we do know is that there may be some genetic element, there may be some impact on our brain chemistry, which is the basis on which some medication may work. Um, uh, but just because we may have some genetic link, no study has found that that genetic link is the biggest contributor. Yeah,
Right. Right.
it's much more significant that we know that there are learned behaviors.
Mhm.
And the beauty of that is, if you learn to do things one way in life, you've got the capacity to learn. You know, in Islam, it's so valuable to keep learning from cradle to grave.
Yeah.
If you
Yes.
can learn to do one thing one way, to think about something in a way and behave in a particular way, the beauty is you can learn to think about it in a different way and react to it in a different way. And you know,
Um,
in some
we
way,
have a sorry, we have a
go ahead.
question. Someone sent in a question. They're saying, "How do I know that if I'm possessed by a jinn or it's just whispers of shaitan, or I actually have a problem?"
Good question. Good question. There was a paper from one of the universities in Egypt that I read recently that looked at the sort of history, the scholarly history of how we make sense of waswasa, you know, the whispers of the devil, and jinn possession, and OCD. And I think, you know, there has been some confusion with these different issues. One way we can start making some differentiation is when, for example, the individual experiencing these intrusive thoughts initially may feel that there's no control, and if we can look for exceptions that, hang on, there has been some control you've been able to exert. You have been able to stop yourself. And the other aspect is when I have these thoughts, do I like them or do I dislike them? Now, if that thought is coming to me and I dislike it, regardless of where it's coming from, it's telling me that I have some control. There's something I can do. I can't maybe control what thought comes into my head, but what I can
Yes.
control is my response. And you know, Allah subhanahu wa ta'ala has put each one of us here on this earth and given us tests that we didn't choose. It's not the test we're supposed to control, it's our reaction to that test. And that may be
Beautiful.
a useful thing to hold in mind when trying to respond to some of these challenges.
Dr. Sarfraz, we have only 2 minutes left. If you could give us our final message.
So, inshallah, there's something that we can recognize maybe within ourselves or people that we love, where we notice that if they're feeling very anxious or they're doing things to an excess, we can support them to find out, you know, is this really working out for you? What's the negative impact? Should we get some help? And if we can get some help, to make sure we test out, we make sure we go to reliable sources, and that we maintain that compassion, that we support them and ourselves to try and get back onto the right path to fulfill our potential, and take those sometimes difficult steps, but have faith in Allah that actually if I take these steps in a reliable way, actually I can come to some resolution.
Thank you so much for your valuable time and all the information that you have shared with our viewers today. And I'm sure people must have found it really beneficial. Jazakumullah khair.
Inshallah. Thank you very much. Khulda Hafiz.
For those of you who are struggling or know someone who is struggling with obsessive compulsive thoughts and behaviors, there is a website ocduk.org where you can find more information. If you know a young person who is struggling, they can contact youngminds.co.uk. You can always refer to your GP and you can discuss the problem, and the GP will refer you to a psychotherapist or a psychiatrist if there is a need for medication. मसला कोई भी हो, उस पे एक लम्हा फ़िक्रिया ज़रूरी है, एहतियात ज़रूरी है, सफ़ाई निस्फ़ ईमान है, लेकिन अगर ये सफ़ाई या हाथ का धोना मुस्तक़िल है और मुसलसल है, या कोई भी ऐसी आदत जिससे आप या आपके घरवाले, अज़ीज़ व अक़ारिब मुतासिर हो रहे हों, तो बग़ैर किसी झिझक, शर्मिंदगी के आप अपने जीपी से या किसी प्रोफ़ेशनल मेंटल हेल्थ प्रोफ़ेशनल से राब्ता कीजिए। इसमें कोई भी शर्मिंदगी की बात नहीं है, और जिस तरह इंसान डायबिटीज़ या हार्ट प्रॉब्लम्स में मुब्तला होता है, इसी तरह ज़हनी बीमारियां भी हैं। इसका आपके ईमान के कमज़ोर होने से कोई ताल्लुक नहीं है। अल्लाह ने भी आपको आज़माइश के लिए आपकी औलाद, आपकी सेहत और आपकी दौलत के थ्रू आपको आज़माने का कहा है कुरान में। अपना बहुत ख्याल रखिए। इंशाअल्लाह अगले सैटरडे 12 बजे एक नई आगाही के साथ हम आपके सामने दोबारा हाज़िर खिदमत होंगे। खुदा हाफ़िज़।